Hi, my name is John with the Posture Pain Connection. I'm a postural alignment specialist certified by the Egoscue Institute. Today we're talking about thoracic back pain. So that means pain anywhere from the top of that curve in your lower back, or what you hopefully have is a curve in your lower back, all the way up to the base of your neck. And we'll be addressing this from the perspective of Pete Egoscue's book, Pain Free, the second revised and updated edition. There's also the first edition that looks like this. This has different exercises for thoracic back pain. The difference is these are more updated for the dysfunctions that we present with in modern life, as this is an older book. And if you're wondering what type of pain might be thoracic back pain, if you have pain when breathing, maybe a rib is out of place or something like that, that can be helpful. That can be helped by the information we're going to talk about today. Or it might be pain spreading out from underneath your shoulder blades, or pain in the spine itself. So let's get right into it. This information we're talking about is on page 175 of this yellow and blue and white book, Pain Free. And the exercises we'll be covering in this video are static back, reverse presses in the static back position, pullovers also in the static back position, floor blocks, which I've already covered modified floor blocks in a previous video, and this will be in the unmodified version of floor blocks. Then static extension and squat, or what I like to call static squat because it's not going up and down usually. So let's get right into it. One quick word before we get into this routine for thoracic back pain. This video is not meant to be construed as medical advice for any specific symptoms. This is more as a review of the menu that Pete Egoscue presents in his book and my interpretation of it, and some tips on why I like it, tips on how you can perform it, things like that. Generally speaking, your body has to be your responsibility. If you feel you can't do any of these exercises or it might hurt, you need to make sure you use proper judgment. And if you really need a disclaimer, you probably shouldn't be watching this video anyways. While we're discussing the menu for thoracic back pain in this pain-free book, I'm going to be talking to you a little about the reasoning behind these exercises and help to give you an idea of why they tend to work. If you want full descriptions and full instructions on any of these exercises, you can check out the cards for this video, or there's also a playlist that I'll have linked in the description. Now, the first exercise is static back. If you're not familiar with static back, it's one of the top exercises for postural therapists to use, especially when people are just starting out in postural therapy, because it is a very passive exercise and it is great for reducing chronic pain and great for bringing the body into a more upright position. And it does this very passively without a lot of exertion. It's a great way to start out a menu for thoracic back pain, because if your back is hurting, this can help to alleviate that pain before we get into the more difficult exercises. Now, one thing I love about this menu is that the next two exercises in it are also performed from the static back position. Makes it a lot easier to get into this. So first we're doing the reverse presses in the static back position, and those are geared to improve your scapular mobility while reducing compensations in the spine and lower body. And the same thing goes for the pullover exercise. We're working a different motion of the scapula and shoulders, reducing compensations in the thoracic spine, the lower body. Now, let's get to the floor blocks exercise. The floor blocks exercise is great for improving scapular position and the position of your shoulders and the position and then thoracic flexion. If you have a slumped posture, this is a great exercise for getting the shoulder blades into a better position, getting the thoracic spine upright, and reducing compensations in the lower body, as well as improving hip rotation and pelvic rotation. This is just a great all-around exercise. If you find yourself having trouble doing it, be sure to check out the card in this video for the modified floor blocks, where I have instructions for that exercise. It's a modified version of floor blocks, as the name implies, that is easier to do, not quite as strenuous. When you're ready, you can move into the floor blocks from modified floor block. Next is the static extension position. Static extension is great for improving strength in the shoulders and the thoracic spine. It's great for improving thoracic position and getting that thoracic spine to go into extension rather than flexion. So it helps you get out of that slumped posture. It also helps with stretching out the abdomen muscles, relaxing the lower back, and strengthening the hips to a certain degree. Now you'll notice that I'm doing the modified version of this either on my elbows or on my hands without my knees on a block. For me personally, I find that position easier to get into, and the one with my knees on the block can even be painful for me sometimes. So I use this static extension position as a substitute for static extension. And finally, the last exercise in this menu for thoracic back pain is the squat, or static squat as I usually like to call it. And this is a fairly simple exercise. You just need to make sure you have something sturdy enough to bear your weight, and you're just keeping your ankles right underneath your knees and trying to get down to that 90 degrees of flexion. It might be a little difficult at first, but if you keep at it over time, you'll improve the strength in your lower body while you're reducing compensations in the upper body. There's my review of the menu for thoracic pain in this book here, Pain Free. This is the revised and updated edition. Now, it should be noted that none of these menus can promise a quick fix. It requires persistence and dedication over a long period of time of doing these exercises to see lasting benefits. You know, when I first started postural therapy, I was actually in a wheelchair and I couldn't even stand up really unassisted. And it took a couple months to be able to take a couple steps so that I could, after 6 months, I could like walk into a gas station, things like that. And now I can do anything I want. I've been practicing for over 3 years now. But you need to understand that it takes time to get where you want